Well, let me ask you, is there anything else that you wanted to get across in this interview that maybe you haven't articulated in the way that you would like to?
Maybe it's implicit in what I've said, but the first thing I would say is once you start seeing things through the lens of shame and pride, you start seeing it showing up everywhere.
Yeah,
And you could say, well, that's a problem. Like it's not really, it's actually there. And the reason it's there implicitly is because we're talking about some things that are just fundamental to being human. Self,
right.
my relationship with myself, my relationship with you, our relationship, the sense of a group or a tribe. So number one, it shows up all the time. And in trauma, relational trauma, it's going to always show up because the fear and shame, two main drivers of trauma, fear and shame, is what the trauma in relationship is about. So the first thing is expect it to show up. The other thing would be find ways to name it. Sometimes people say, well, I don't want to name it as shame because they're going to feel more shame. I would say it's like saying, I don't want to name the word suicide when the person is suicidal. It's the
Right.
opposite.
Yeah.
So I have learned to get comfortable with naming it. And in some ways, just the name actually allows them to get a little bit of psychological distance between the experience, the state of mind and body, and the capacity to observe. And that capacity to observe with genuine interest, non judgment, non shaming, is an essential part of the healing. So I've learned to name it and have a way to help people name it so that they can be in it and observe it at the same time. Um, so I guess that would be some of the things, and I would just emphasize that the shame that people struggle with as therapists with patients who've experienced trauma is not the shame of I'm having a feeling. And so you have to appreciate the aspects of this that relate to dissociation, that relate to a kind of a chronic state, not just in this moment. And you have to have special ways of working with that, just like you have to have special ways of working with trauma more broadly. So, understanding that will sometimes help therapists at least understand why they're getting stuck and that there's other ways to work with this. Um, I have my ways, other people have theirs, but there's ways to work with this um, that go beyond um, that go beyond quote unquote helping a person feel okay about themselves again.